we do offer a few different opportunities for the fellow. They have an opportunity to do pediatric acute pain medicine at our Children's Hospital Center. We'll spend considerable time at our outpatient ambulatory surgery center, which is very orthopedic surgery heavy and lends itself to a lot of different types of blocks that you need to have within your repertoire. And then we also have an opportunity to perform a really wide variety of interventional techniques and acute pain management techniques here on campus. As a large tertiary care level 1 trauma center, there's really endless opportunities for us to spread our tentacles throughout the hospital and have a positive impact on patients really in every corner of this institution.
When we think of good fellows in our program, I think what we're looking for is fellows that are eager to learn, eager to participate, and willing to try new ideas or look for new approaches to the same problems we see. And I think that's sort of the gist of regional and acute pain medicine, is that patients come down with lots of different injuries or surgical procedures planned, and we have to adapt to the best way to control their pain, and there's a lot of ways to do that.
We really lean on our fellow quite a bit to be able to push us to be better clinicians ourselves, to be better teachers, and we also put a considerable amount of clinical responsibility on their shoulders. We don't have to work them into the ground from an hours perspective to achieve that, but they have every opportunity to really take ownership of their both clinical and educational experience and to really bring everybody up within our department.
Our training institution is unique because it's large enough, has enough basis for research and academics in medicine that we're able to provide a trainee with opportunities to learn and see different things that they wouldn't see at a smaller institution. But we're not an institution that's too large with multiple competing fellows and residents who might be competition with you while you're trying to learn new techniques. So you do get the opportunity to learn these new techniques, and you're not struggling to find a patient load to learn new techniques.
One of the greatest strengths of our program is the collegial atmosphere you have between faculty, residents, fellows, even down to nurse anesthetists and all these other folks in the department. Is everyone gets along real well, and that isn't just superficial. That's genuine. When I'm having trouble or residents having trouble, they can reach out to faculty, another resident, a fellow, and people are really willing to help. And you don't get that everywhere, and it's real genuine here that we're all on the same page trying to move the boat forward in the same direction. I always tell people Omaha's got all the great things of a good-sized city without a lot of the problems. The food scene's outstanding, tons of great restaurants, lots of fun things to do, whether you have kids, whether you don't have kids, whether you're just looking for a comfortable place to raise a family or a lower cost of living city. Omaha kind of checks all those boxes, and you can sort of make it whatever you want it to be without ever having to get too far away from campus. So.
I think if you want to be a strong clinician with an academic flair, I think this is the place to come to. I think we will provide you with the abilities to train to be a strong physician. I think here we offer a good balance between academics and clinical duties, and I think that's real important because that at least helps me continue to treat my patients and learn the best way, not just read about the best way from someone else's opinion.